Welcome to our low-fidelity prototype entitled CareSteps. We curated an app that puts a patient's recovery in one simple place. As you can see, we have hyperlinks leading to their discharge plan, their medications, their skincare, their mobility plan. All of that will be curated into a schedule, some daily encouragement, and then recovery facts. We'll go over each section in a little bit more detail.
In the second tab, we have discharge plan. This is where we're going to upload discharge plans via photo or file, whether it be the physical copy that you receive at discharge from the hospital itself, where you can take a picture and upload it, or if you get a file from MyChart or things of the like that you can upload. From there, we're hoping that once we are able to get the discharge plan uploaded onto that tab, that the website will, or the app will be able to take those interventions, medications, things like that, and kind of place them in the correct tabs further down the line. In the next tab, we have medications. This is where you can upload every medication that you have, whether it be for a discharge, or you can put just like your daily meds in there as well. So we'll kind of do an example. So we'll hit add medication. And for this example, we'll do cephalexin. So we'll put that in that space, and then we'll do 500 milligrams in the dosage space. And then for the schedule, we'll do every 6 hours. And then for purpose, we'll put infection prevention. And then for instructions, we will do finish entire course and take with food if your GI gets upset. Also with these medications, once we put them in and submit them and save them, they should all transfer over to your schedule, where you will be able to see when your meds are due and that kind of thing. Next, we have skincare. This is where you can put all of your skincare instructions and interventions that you are supposed to be doing at home. Once you hit add skincare item, it gives you options of doing an item name, so you can do dressing change, wound cleaning, that kind of thing. Type, it has a drop-down menu for ointment, cream, dressing, or other. You can pick if there's a specific body area that it's supposed to be in, how often it needs to be done, and then there's instructions. So then these instructions can be like washing your hands, clean with soap and water, or keep clean and dry, make sure your dressing is clean and dry, that kind of thing. And you can add times for when these are all due, just to kind of like plan out your day if need be. We are also hoping that in our recovery at a glance, or in our discharge plan tab, where there is going to be all the different interventions that need to be done, medications, dressing, skincare, or mobility things, we want to be able to have videos or educational diagrams or informatics that clients can choose and click on, and it'll redirect them so they can get a better and deeper understanding of what they're supposed to be doing at home.
This next tab that we have is plan your mobility exercises. This is where a patient would add any PT or OT instructions and the specifics for them. So like what the exercise is, how often they should do them, how long each session should take. They would click on add mobility item, and it would take them to a form where they can add all of those details. This next tab that we have is your schedule. This is where a patient's tasks would all appear after they schedule them. So their medications, skincare, mobility, all those tasks would appear on their calendar. It'll show their total tasks, how many are completed, how many are remaining. They can add more tasks directly on this tab, or they can go back to medication, skincare, mobility, and add the tasks there. Our next tab is called Daily Encouragement. This is a motivational message that will appear each day, and each day it'll be different. So like today's encouragement, your effort matters, and it is enough for today. And then for tomorrow, it would be new.
Our last little tab up here in the right-hand corner is Recovery Facts. If you click on this, we basically have put some information regarding frequently asked questions. Patients can look here for some quick help. If this is not adequate enough, or if a patient's question hasn't been asked yet, our app does have an AI chatbot where you can ask Sophie what you need, review discharge plan details, explore the recovery facts. If you cannot type or there is some inability there is a voice option as well as a history option, so you can go back and see the questions you have asked. Overall, the challenge in healthcare delivery our team wanted to solve with CareSteps is to ensure adequate discharge instructions are provided to the patients regarding the risks and complications associated with limited mobility. In order to do that, we simplified it so that you aren't always wanting to call your doctor and all of your information is in one spot. Our target population includes adult patients who are discharged from the hospital with limited mobility, mobility restrictions, or permanent changes to their mobility status that want to have their whole plan in one space. We are hoping that CareSteps simplifies the recovery process a little bit more for the patients who still have lingering questions post-discharge.